Thanks for the invite and the opportunity to speak to your audience. I had sent my slides over. I'm not sure how we're showing the slides, but I thought your staff was going to give me a call. They said they had them, but oh, there they are. Okay, great. Now I just have to figure out how to advance them. So we're obviously MicroGen Diagnostics. We're a high complexity lab that provides next gen sequencing services. And on the topic of ASCs, really that's a huge advantage for this technology because where you might have to rely on a send out lab like LabCorp or Quest with traditional cultures, you could send your samples directly from the ASC to MicroGen and have next gen sequencing provided versus standard culture. And there's no cost to the ASC because that's considered a site of service, as similar as a clinic or office. And MicroGen is the only test available in the nation that provides this service that has a CMS approved reimbursement code. So we're covered by Medicare. Medicare reimburses us $350. If you're using this technology in your hospitals, we have to invoice the hospitals, and the hospital cost is $350, which compared to traditional cultures is a great price difference because we're not doing, each sample billing. If you send us multiple samples, which is what we recommend, multiple pieces of tissue, fluid, multiple swabs, all that's combined and gives you one report, and it's one cost of $350. Or if it's an ASC, we're billing the patient's insurance, Medicare, or private pay, and we're getting reimbursed, so there's no cost to the ASC. If you could advance the next slide for me. So, anytime you're looking at a diagnostic tool, obviously accurate evidence. I want to just talk about some of our evidence we've had in the last couple of years. I've been working extensively with a group on providing the evidence for the clinical utility of next-gen sequencing. Turnaround time is critical. We're at 3.5 days and hopefully going to be improving that. And obviously the cost is a factor, and I talked about that, and reimbursement is a factor, and I talked about that. Next slide. The first study we did a couple of years ago with Dr. Parvizi at Rothman was a single site study where MSIS positive patients, we showed a 30-point difference between patients with cultures versus our technology with next-gen sequencing. So you're able to pick up the species with a higher sensitivity with molecular and our NGS test. And in that study, we had about a 30-point difference between the two. We also were able to show that these infections were not single pathogens, but were polymicrobial. Next slide. We followed that study up with a recently published multi-center study that we did with 14 institutions around the country. That was published in JBJS last year. And in November of last year, we were told that we were selected as one of the top 10 studies, research publications for JBJS and for 2022. So very proud of the fact that this study was over 1,000 patients, and it was recognized as one of the top research studies for the year by JBJS. And essentially, again, what we found in this study that when patients met the criteria for infection and cultures were negative, we were able to give the surgeon a signal, and in most cases, it was a polymicrobial signal that we found. People have a perception that we're going to find a laundry list of bacteria. Not the case. In this study of over 1,000 patients, the average number of species that we identified in these infected cases was three species. So that's not too difficult for your infectious disease guys to consult on and make decisions on antimicrobials. Next slide. Just a little bit more background on the study. Again, talked about most of these points. Again, these samples were collected in the OR, and they were sent to our lab in Lubbock, Texas for processing. Next slide. I would just kind of close in saying that this technology, it definitely gives you the opportunity to be able to identify the cause of these infections, especially when cultures are negative. I would say it's not trying to position it not as an either or, that you're doing cultures or next-gen sequencing. Given the consequences of these devastating infections, I would advocate, since the price point is $350, you do both. And if the culture is negative, at least you have a signal that we can provide you to give you direction on prescribing antimicrobials. So Happy to help anybody set this up in their hospitals or ASCs. Again, ASCs are pretty easy because we don't have to go through the bureaucracy of hospitals, but we are getting more and more contracts because of that multi-center study. So we're in a lot of the major systems nationwide. If you want it available in yours, I'm happy to help you and work with your lab and microbiology and ID departments. Thank you, Dr. Crusher. That's it.